Dr. Joshua Nderitu, a family physician from Wellness Health Services. Today we will be talking about the evaluation of the patient with the hypertension. The first thing when you encounter the patient with hypertension, you have confirmed the patient has hypertension, is the clinical history. The clinical history that you want to get from the patient, you want to know does the patient have the signs and the symptoms of hypertension or the complications of hypertension. So you'll be asking questions about does the patient have leg swelling, does the patient have any change in the urine output, is there any change in the color of the urine, any epigastric pains or pains in the abdomen, and also you'd also be interested with patients having chest pain. You also want to know about patients having difficult breathing or patient having easy fatigability. So the history will help you to know does the patient have primary hypertension or secondary hypertension, and also you want also to know the complications that the patients might be having. Then you also want to know about the patient dietary practices, exercise, other drug that the patient is taking, which might have an impact on his hypertension. Then after you have done the history, then there is also the issue of the physical examination. The physical examination, we are looking also for the signs of secondary causes of hypertension, and also the possibility of the presence of head organ damage. So you'll be looking at, does the patient have any leg swelling, where is the position of the apex bit, how are the neck fins, does he have prominence of the neck fins, an indication of heart failure. Then after you have done the examination of the patient, there are basic tests that you'd want. One of them we would want to see is the full blood count, to see how is the patient's level of the hemoglobin, and then you also order a blood urea nitrogen and the electrolytes. This will guide you into the possibility of does the patient have any kidney disease, has the hypertension affected the patient's kidney functions. And then the other basic test is a urinalysis. From the urinalysis, you are looking at is the patient losing any albumin or proteins from the urine. Then you would also be interested to have a chest X-ray. From the chest X-ray, you are looking at what is the heart size. Does the patient have any signs of heart failure from the chest X-ray? And you would also want to know whether the patient has heart failure. Then the other basic test is an ECG or an echocardiogram, which will show you how is the patient's rhythm, what is the heart size, and so with these basic investigations, you are able to now decide what is the way forward for the patient. As I have said, the most critical thing when you are looking at the patient is you want to establish does the patient have secondary complications of hypertension. We are looking at head organ damage. When you are looking at the head organ damage, we are looking at does the patient have any brain complication, eye complications, heart complications, kidney complications of hypertension, or any signs of arterial diseases in the peripheries. Then you are also trying to look at secondary causes of hypertension, and the common secondary causes of hypertension, as we said, is kidney disease, endocrine problems, vascular problems. Those are the most common ones. Then the other thing that you'd also want to establish is what level of hypertension does the patient have. Is it an emergency? Is it an urgency? Or is just essential hypertension? We are talking about an emergency is that the blood pressure should be brought down within hours. When we are talking about an hypertensive urgency, you want to bring the blood pressure down, but over time. So thank you very much. This is all I discussed for today about evaluating a patient with hypertension. Thank you. We'll continue with our series. So next week we'll be talking about lifestyle management of hypertension. Thank you.